Hey there, everyone. Welcome back. You are watching Insight. You know, this next segment, this is for whether or not you're a weekend warrior, you're always out and about and you're really active, or maybe you're not that active at all. It's still important to be mindful of the injury, about the falls that could possibly happen. Right now, I am here joined by Claire, the clinical director over here at BenchMark Physical Therapy in Columbia City. Claire, I mean, it's important to be able to have that preventative measures, making sure that you've got that balance, that strength in your muscles. Talk to me about what all of the things that you guys do here at BenchMark.
Absolutely. We are an outpatient provider here in Columbia City. We also have our outpatient clinic in New Haven as well, called Dreyer Physical Therapy. We see at both locations pediatric patients. We see pelvic health patients. We see those weekend warriors that maybe overdid it on the pickleball court.
Yeah.
As well as the post-surgical patients. So knee replacements, hip replacements, back and neck surgery. So we kind of see everything and like to serve our communities so that they have a one-stop shop and don't have to go multiple different locations for different ailments.
Yeah. Let's talk a little bit about those screenings, right? When someone says, okay, look, free screening to be able to look at, trying to avoid maybe those injuries or those falls, or the best way to be able to treat it. Who qualifies for those free screenings?
So anybody over the age of 18 can come. It's not just our senior citizens that are 65 that are at vulnerable risk for falling. Anybody with musculoskeletal conditions, so those post-op patients we talked about, or even anybody with a neuromuscular issue, so Parkinson's, MS, any of those, debilitating neurological progressive injuries can be at risk for falling. So we will see anybody over the age of 18.
All right, so you come in and you're doing the screening, right? What exactly can people expect when they come in and do that screening?
Absolutely. So we're going to be assessing gait, we're going to assess balance, we're going to assess functional strength. All three of those can predict what your fall risk will be. And some of those tests are called the timed up and go. We have then the 30-second sit to stand, which is a functional strength. And then we also have a Y balance test, which tests your dynamic balance in different planes of motion.
Some things that are really kind of simple, but also really helps you kind of think about, okay, what are some things that maybe I should work on? Talk to me about the Move to Live. How does that work? What kind of program is that?
Yeah, so our Move to Live campaign started here at the end of October and will run all the way through the end of November.
Okay.
And it's really important because every second someone over the age of 65 falls. Falls are actually the leading risk for serious injuries and death in our senior citizen population. And by coming to do the Move to Live screens, they can learn and we can see indicators that would lead to a fall risk and then provide them with some, research as well as suggestions of what they can do. Moving rugs out of hallways and bathrooms, putting night lights in the hallways in those bathrooms, and then also, making sure they see their doctor annually for those medication checks, because sometimes those medications, especially blood pressure, can really affect dizziness and increase fall risk.
Okay. So as people look into the screenings, as people looking to getting in here for those services, what's the advice as far as people being able to take those first steps and getting that screening, getting in here for an appointment?
Yeah. Research shows that prevention is your best form of medicine. If you go into PT anywhere or get a fall screen and you're aware and educated of what's important, you're oftentimes going to be able to then decrease that fall risk, which then decrease hospitalizations, job loss, and money loss ultimately. So all they have to do is sign up on our Move to Live campaign online, movetoliveusa.com, and we're doing them from 9 to 4 Monday through Friday. And they can sign up for the time that they would prefer as well as the location, and our awesome office coordinators will be calling them to set it up.
Okay, well look, we appreciate you so much for being able to share with us, get in to be able to talk to them, also coordinators who are here. It's important to be able, like you said, that preventative care, knowing, okay, do I need to work on my balance? Do I need to work on my strength? Do I need to work on my agility, my ability? It's just really important, and like you said, kind of getting ahead of the ball. That's what's most important.
Absolutely.
All right, thank you so much, Claire, for having us here.
You're welcome. Thanks
All
for
right,
coming.
yeah, everyone take a look at your screen right now. Find out more information about BenchMark Physical Therapy. See, hey, maybe I should get out there for that free screening. We'll be right back.